Hi, welcome to another episode of Medicine Simplified. In this video, we will know about Wolcott-Rallison Syndrome, its causes, symptoms, and treatment. Coming to the introduction, Wolcott-Rallison Syndrome, in short called as WRS, was named after doctors Wolcott and Rallison. It is also known as multiple epiphyseal dysplasia and early onset diabetes mellitus. Epiphyseal dysplasia is a genetic disorder affecting the cartilage and bone development at the end of long bones. So, epiphyseal dysplasia affects long bones. This is a rare disease seen in Middle East, North Africa, Pakistan, and Turkey. Majority are Islamic countries, where consanguineous marriages are frequent. The marriages between who are closely related are cousins. WRS is a rare autosomal recessive disorder with infancy onset diabetes mellitus, multiple epiphyseal dysplasia, osteopenia, mental retardation or developmental delay, and hepatic renal dysfunctions as clinical findings. When we find infancy onset diabetes mellitus, multiple epiphyseal dysplasia, mental retardation or developmental delay with hepatic or renal dysfunction, we can diagnose it as WRS. So, what are the causes? WRS is caused by mutation in EIF2AK3 gene, which provides instruction for making protein called as eukaryotic translation initiation factor 2 alpha kinase 3. This protein is important for controlling the process of protein synthesis, particularly during period of cellular stress. Mutations in EIF2AK3 gene disrupt the normal function of protein, leading to various cellular and metabolic problems, including impaired insulin secretion. How it affects? EIKF2AK3 gene codes for PERK, which stands for pancreatic endoplasmic reticular kinase. PERK is associated with activity of beta cells in pancreas. We all know that beta cells are needed for proper release of insulin into the blood. That's why we can see infant diabetes mellitus. Coming to the symptoms of WRS can vary in severity, but they typically appear in early in life, often during infancy or early childhood. Here are some common symptoms which include early onset diabetes mellitus, where children with WRS often develop diabetes at very young age, usually before 6 months of age. This diabetes is usually insulin dependent and requires lifelong insulin treatment. Next is growth retardation. Affected individuals may experience delayed growth and developmental milestones. Episodic liver dysfunction. As we spoke earlier, liver, hepatic, and renal disorders are common in WRS. Episodic acute pancreatitis. The inflammation of pancreas can lead to recurrent abdominal pain, vomiting, and other symptoms associated with pancreatitis. Skeletal abnormalities. Some individuals with WRS may have skeletal abnormalities, and we can see delay in bone development. Intellectual and developmental disabilities. Cognitive and developmental issues can be present in some cases. Most patients with this disease do not survive to adulthood. Majority of WRS patients die from fulminant hepatitis during childhood. Coming to the investigation before diagnosing the WRS, laboratory tests which include blood glucose and glycated hemoglobin levels to measure the diabetes mellitus, liver function test for evaluation of liver enzyme levels, lipid profile to measure the cholesterol and triglyceride levels, because lipid metabolism can be affected in WRS. Pancreatic enzymes to assess pancreatic enzyme levels to monitor pancreatitis. Next is gene testing, EIF2AK3 gene sequencing, and next generation sequencing. NGS techniques may be used to analyze multiple genes simultaneously, helping to rule out other genetic conditions with similar symptoms. Coming to the imaging studies, we will do abdominal ultrasounds to assess the structure of pancreas, liver, and other abdominal organs. X-rays or bone scans for identifying skeletal abnormalities. MRI or CT scan used to further evaluate the pancreas, liver, and other affected organs like kidneys. Metabolic and hormonal studies. First, we will do insulin and C-peptide levels. Next, we will do thyroid function test to evaluate thyroid hormone levels to rule out associated endocrine issues. Coming to the treatment, since WRS is a genetic disorder, there is no cure for condition. Treatment mainly focuses on managing symptoms and complications associated with syndrome. There are some aspects of treatment. So, as we know, in early infancy, they will suffering from diabetes mellitus. So, they are insulin dependent. So, we will include insulin therapy in treatment and nutritional support. Management of complications like pancreatitis, liver dysfunction, and other associated issues. In the few cases that develop hypothyroidism, treatment with thyroxine is indicated, with target to maintain normal circulating TSH hormone. These are causes, symptoms, and treatment for WRS. If you like this video, please subscribe to our channel. Thank you.